NCLEX are an exam-style practice questions and answers. Question 1. A female client at 36 weeks gestation has been treated successfully for premature labor for 4 weeks. She has begun having uterine contractions today and has been admitted to the labor and delivery suite. Her amniocentesis results reveal a lecithin-H sphingomyelin LHS ratio of 2 and positive phosphatidylglycerol Pg. These lab values indicate, here are the options. Option A. Placental maturity. Option B. Suspected chronic asphyxia. Option C. Cord compression. Option D. Fetal lung maturity. The correct answer is option D, fetal lung maturity. A placental maturity is assessed by a biophysical profile. BL/S ratio and presence of phosphatidylglycerol are not used to determine fetal asphyxia. A biophysical profile score of 6 may indicate this condition. C. Cord compression is not reflected by the L/S ratio or presence of phosphatidylglycerol. Variable decelerations observed through electronic fetal monitoring could reflect umbilical cord compression. D at L/S ratio 2 and the presence of phosphatidylglycerol in amniotic fluid indicate fetal lung maturity. Question 2. A prima gravida with a blood type A negative is at 28 weeks gestation. Today her physician has ordered a RhoGAM injection. Which statement by the client demonstrates that more teaching is needed related to this therapy? Here are the options. Option A. I'm getting this shot so that my baby won't develop antibodies against my blood, right? Option B. I understand that if my baby is Rh positive, I'll be getting another one of these injections. Option C. This shot should help to protect me in future pregnancies if this baby is Rh positive, like my husband. Option D. This shot will prevent me from becoming sensitized to Rh positive blood. The correct answer is option A. I'm getting this shot so that my baby won't develop antibodies against my blood, right? A RhoGAM is given to Rh negative mothers to prevent the maternal Rh immune response to fetal Rh positive antigens. B. If the infant is Rh positive, the mother will receive another dose post-delivery to prevent maternal sensitization. C. Prevention of maternal sensitization will protect future pregnancies because the mother's blood will be free of antibodies against her fetus. D. RhoGAM prevents maternal sensitization to Rh positive blood. Question 3. At her monthly prenatal visit, a client reports experiencing heartburn. Which nursing measure should be included in her plan of care to help alleviate it? Here are the options. Option A. Restrict fluid intake. Option B. Use Alka-Seltzer as necessary. Option C. Eat small, frequent bland meals. Option D. Lie down after eating. The correct answer is option C. Eat small, frequent bland meals. At least 8 glasses of fluid per day are encouraged to help dilute stomach contents, thereby decreasing irritation. B. Alka-Seltzer contains aspirin, which is irritating to gastric mucosa and therefore should be avoided. C. Small, frequent bland meals help to decrease gastric pressure and to prevent reflux. D. Lying down after meals may cause gastric reflux and prevents optimal gastric emptying. Question 4. A client is dilated at 8 cm and entering the transition phase of labor. Common behaviors of the laboring woman during transition are, here are the options. Option A. Frustration, vague in communication. Option B. Seriousness, some difficulty following directions. Option C. Calmness follows directions easily. Option D. excitement, openness to instructions. The correct answer is option A. Frustration, vague in communication. During the transition phase, the mother may become frustrated and unclear in her communication owing to severe pain and fear of loss of control. These behaviors are common in the active phase of labor. These behavioral clues are seen in the latent phase of labor. These characteristics are observed in the latent phase of labor. Question 5. The FHR pattern in a laboring client begins to show early decelerations. The nurse would best respond by, here are the options. Option A, notifying the physician. Option B, changing the client to the left lateral position. Option C, continuing to monitor the FHR closely. Option D, administering O2 at 8L/min via face mask. The correct answer is option C, continuing to monitor the FHR closely. Early decelerations are reassuring and do not warrant notification of the physician. Because early decelerations is a reassuring pattern, it would not be necessary to change the client's position. Early decelerations warrant the continuation of close FHR monitoring to distinguish them from more ominous signs. DO2 is not warranted in this situation, but it's warranted in situations involving variable and/or late decelerations. Question 6. A female client is admitted to the emergency department complaining of severe right-sided abdominal pain and vaginal spotting. She states that her last menstrual period was about 2 months ago. A positive pregnancy test result and ultrasonography confirm an ectopic pregnancy. The nurse could best explain to the client that her condition is caused by, here are the options. Option A, abnormal development of the embryo. Option B, a distended or ruptured fallopian tube. Option C, a congenital abnormality of the tube. Option D, a malfunctioning of the placenta. The correct answer is option B, a distended or ruptured fallopian tube. The embryo itself may develop normally in the first several weeks of an ectopic pregnancy. An ectopic pregnancy in the fallopian tube causes severe pain owing to the size of the growing embryo within the narrow lumen of the tube, causing distension and finally rupture within the first 12 weeks of pregnancy. The fallopian tube may either be normal or contain adhesions caused by a history of pelvic inflammatory disease or tubal surgeries, neither of which are congenital causes. An ectopic pregnancy does not involve a dysfunctional placenta, but the implantation of the blastocyst outside the uterus. Question 7. A female client at 10 weeks gestation complains to her physician of slight vaginal bleeding and mild cramps. On examination, her physician determines that her cervix is closed. The client is exhibiting signs of, here are the options. Option A, an inevitable abortion. Option B, a threatened abortion. Option C, an incomplete abortion. Option D, a missed abortion. The correct answer is option B, a threatened abortion. An inevitable abortion includes the signs of cervical dilation and effacement as well as pain and bleeding. A threatened abortion is a condition in which intrauterine bleeding occurs early in pregnancy, the cervix remains undilated, and the uterine contents are not necessarily expelled. An incomplete abortion occurs when some portions of the products of conception are expelled from the uterus. A missed abortion occurs when the embryo dies in utero and is retained in the uterus. Question 8. A female client at 36 weeks gestation is experiencing preterm labor. Her physician has prescribed 2 doses of betamethasone 12 and GINQ24H. The nurse explains that she is receiving this drug too. Here are the options. Option A. Treat fetal respiratory distress syndrome. Option B. Prevent uterine infection. Option C. Promote fetal lung maturation. Option D. Increase uteroplacental circulation. The correct answer is option C. Promote fetal lung maturation. A respiratory distress syndrome occurs in the newborn, not the fetus. It may be treated postnatally with surfactant therapy. Betamethasone is a corticosteroid, not an anti-infective drug. Therefore, its use would not prevent uterine infection. C. Betamethasone binds with glucocorticoid receptors in alveolar cells to increase production of surfactant, thus increasing lung maturity in the preterm fetus. D. Betamethasone does not affect uteroplacental circulatory exchange. Question 9. A female client at 30 weeks gestation is brought into the emergency department after falling down a flight of stairs. On examination, the physician notes a rigid, board-like abdomen, FHR in the 160s, and stable vital signs. Considering possible abdominal trauma, which obstetric emergency must be anticipated? Here are the options. Option A. Abruptio placentae. Option B. Ectopic pregnancy. Option C. Massive uterine rupture. Option D. Placenta previa. The correct answer is option A. Abruptio placentae. A abruptio placentae, the complete or partial separation of the placenta from the uterine wall, can be caused by external trauma. When hemorrhage is concealed, one sign is a rapid increase in uterine size with rigidity. B. Ectopic pregnancy occurs when the embryo implants itself outside the uterine cavity. C. Massive uterine rupture occurs during labor when the uterine contents are extruded through the uterine wall. It is usually due to weakness from a pre-existing uterine scar and trauma from instruments or an obstetrical intervention. D. Placenta previa is the condition in which the placenta is implanted in the lower uterine segment and either completely or partially covers the cervical OS. Question 10. A 4 days postpartum client who is gravida 3, para 3, examined by the home health nurse during her first postpartum home visit. The nurse notes that she has a pink vaginal discharge with a serous sanguineous consistency. The nurse would most accurately chart the client's lochia as, here are the options. Option A. Rubra. Option B. Rotha. Option C. Tarosa. Option D. Alva. The correct answer is option C. Erotha. A lochia rubra is bloody with clots and occurs 13 days postpartum. B. There is no such term as lochia rosa. C. Lochia serosa is a pink-brown discharge with a serous sanguineous consistency that occurs 49 days postpartum. D. Lochia alba is yellow to white in color and occurs approximately 10 days postpartum. Question 11. A primipara is assessed on arrival to the postpartum unit. The nurse finds her uterus to be boggy. The nurse's first action should be to, here are the options. Option A. Call the physician. Option B. Assess her vital signs. Option C. Give the prescribed oxytocic drug. Option D. Massage her fundus. The correct answer is option D. Massage her fundus. The nurse should first implement independent and dependent measures to achieve uterine tone before calling the physician. The assessment of vital signs will not help to restore uterine atony, which is the priority need. C. Giving a prescribed oxytocic drug would be necessary if uterus did not maintain tone with massage. D. Fundal massage generally restores uterine tone within a few moments and should be attempted first. Question 12. A female client plans to bottle feed her newborn. Her physician has ordered bromocriptine parlitol to suppress lactation. Which of the following instructions about bromocriptine should be given by the nurse? Here are the options. Option A. Bromocriptine stimulates the production of prolactin. Option B. Hypertension is a primary side effect. Option C. Bromocriptine is generally taken for 5 days. Option D. Her blood pressure must be stable before starting bromocriptine. The correct answer is option D. Her blood pressure must be stable before starting bromocriptine. A bromocriptine inhibits the secretion of prolactin. B. Hypotension is a side effect of this drug. Hypertension is not. C. Bromocriptine is generally taken for 14 days. D. The administration of bromocriptine is delayed at least 4 hours postpartum and given only when the client's blood pressure is stable, because it can cause hypotension and syncope. Question 13. The postpartum nurse should include which of the following instructions to breastfeeding mothers? Here are the options. Option A. Limit feeding times for several days to avoid nipple soreness. Option B. Wash the nipples with soap and water before and after each feeding. Option C. Daily caloric intake should be increased by 500 cal. Option D. Breast milk is totally digestible by the baby because it contains lactose. The correct answer is option C. Daily caloric intake should be increased by 500 cal. Eliminating initial feeding times will only delay nipple soreness as well as the establishment of the letdown reflex, thus encouraging engorgement from clogged ducts and ductules. V. Soap should be avoided because it may be excessively drying, predisposing nipples to cracking. C. For optimal milk production, an additional 500 kcal over maintenance levels are needed daily. D. Lipase, not lactose, emulsifies the fat in breast milk, making it almost totally digestible by infants. Question 14. At 12 hours post-vaginal delivery, a female client is without complications. Which of the following assessment findings would warrant further nursing interventions? Here are the options. Option A. Apical pulse of 52 bpm. Option B. Uterine fundus palpable left of midline. Option C. No bowel movement since delivery. Option D. Oral temperature of 100.4 F. The correct answer is option B. Uterine fundus palpable left of midline. A bradycardia of 5,070 bpm may be considered normal postpartally because the heart compensates for the decreased resistance in the pelvis. B. The uterus is displaced from the midline by a full bladder. This condition could lead to a boggy uterus and increased risk of postpartal hemorrhage. Therefore, the bladder should be kept empty. C. Re-establishment of normal bowel function is delayed into the first postpartum week. D. A postpartum woman's oral temperature may go as high as 100.4 F within 24 hours of delivery, resulting from muscular exertion, dehydration, and hormonal changes. Question 15. The nurse observes a client crying quietly. She has just experienced a spontaneous abortion at 9 weeks gestation. An appropriate response by the nurse would be, here are the options. Option A. It must be God's will and probably is for the best. Option B. This must be a difficult time for you. Would you like to talk about it? Option C. I'm sure your other children will be a comfort for you. Option D. Don't worry, you're still young. If I were you, I'd just try again. The correct answer is option B. This must be a difficult time for you. Would you like to talk about it? This response is non-therapeutic because it belittles the client's response and gives a meaningless rationalization. B. This response acknowledges the client's feelings and demonstrates the therapeutic offering of self by the nurse. C. This response is non-therapeutic because it does not focus on the client's feelings and offers false reassurance. D. This response is non-therapeutic because it belittles the client's feelings and offers her advice. Question 16. A 48-hour-old male infant is ordered to have phototherapy. When his mother questions the nurse about its purpose, the nurse explains that phototherapy. Here are the options. Option A. Prevents the development of ophthalmia neonatorum. Option B. Assists the baby's clotting mechanism. Option C. Breaks down bilirubin in the skin into substances that can be excreted in stool or urine. Option D. Increases levels of unconjugated bilirubin, thereby preventing kernicterus brain damage. The correct answer is option C. Breaks down bilirubin in the skin into substances that can be excreted in stool or urine. The installation of erythromycin ophthalmic preparation, not phototherapy, prevents ophthalmia neonatorum. The administration of vitamin K aquamethicin assists the infant's clotting mechanism. C. Excessive bilirubin accumulates when the infant's liver cannot handle the increased load caused by the breakdown of red blood cells postnatally. This excessive bilirubin seeps out of the blood and into the tissues, staining them yellow. Phototherapy accelerates the removal of bilirubin from the skin by breaking it down into substances that can be excreted in stool or urine. D. Phototherapy decreases levels of unconjugated bilirubin, thereby preventing kernicterus. Question 17. After instructing a female client on circumcision care, the nursery nurse asks her to restate some of the key points covered. Which statement shows that the client will properly care for her son's circumcision? Here are the options. Option A. I'll make sure I soak the gauze with warm water first, before I take it off each time. Option B. I'll make sure that I report any drainage around where they operated. Option C. I'll apply alcohol to the area daily to clean it and prevent any infection. Option D. I'll keep a close watch on it for a day or two. The correct answer is option A. I'll make sure I soak the gauze with warm water first, before I take it off each time. Before petrolatum gauze is removed, it should be soaked with warm water to prevent trauma to adherent tissues. A yellow exudate often forms normally over the surgical site. Only if it becomes foul-smelling and purulent would it need to be reported. C. Alcohol should never be used on the site. This would be extremely painful to the infant. D. Special care and observance should continue until the site is completely covered with clean, pink granulation tissue, which could take 710 days. Question 18. A male infant is to be discharged home this morning. Which instruction related to his cord care should be included in his mother's discharge teaching plan? Here are the options. Option A. Keep the umbilical area moist with Vaseline until the stump falls off. Option B. Keep the umbilical area covered at all times with a diaper. Option C. Clean the umbilical cord with alcohol at each diaper change. Option D. Clean the umbilical cord daily with soap and water during the bath. The correct answer is option C. Clean the umbilical cord with alcohol at each diaper change. The umbilical area should be kept dry for healing to occur. Moisture is conducive to bacterial growth and therefore could lead to infection at the site. B. The diaper should be folded below the cord to allow the cord stump to be exposed to the air for healing. C. The umbilical cord should be swabbed with alcohol at each diaper change to remove urine and stool and to facilitate the desiccation process through drying. D. Soap and water should not be used to clean the umbilical area because the area could retain moisture, thus making it susceptible to bacterial growth and infection. Question 19. Which behavior by a female client feeding her newborn demonstrates that she needs more teaching related to safety and infant feeding? Here are the options. Option A. She uses the bulb syringe to help clear her baby's nose when milk is regurgitated. Option B. She places her infant on her right side after feeding her. Option C. She props the bottle in the crib to feed her baby, which allows her to write birth announcements and feed her baby at the same time. Option D. She burps her baby by placing her in a sitting position, supporting her head and neck and gently massaging her back. The correct answer is option C. She props the bottle in the crib to feed her baby, which allows her to write birth announcements and feed her baby at the same time. This practice is the proper use of the bulb syringe to clear the infant's airway in case of regurgitation. B. Placing the infant on either side or on the stomach prevents aspiration of regurgitated milk. C. Bottle propping is an unsafe practice because it increases the likelihood of aspiration. D. This practice is one correct way of burping an infant. Question 20. Newborns are routinely screened for phenylketonuria. The nursery nurse ensures that this screening test is performed. Here are the options. Option A. Immediately after birth, because the most accurate result is obtained at this time. Option B. After 23 days of milk ingestion. Option C. At 23 days of age regardless of amount of milk feedings. Option D. At 1 month, because the biochemical buildup of phenylalanine takes 1 month to detect. The correct answer is option B. After 23 days of milk ingestion. A. The infant has not ingested any protein immediately after birth, which is necessary to detect excessive serum phenylalanine. B. It is important that the infant take in 23 full days of milk or formula feedings to preclude a false negative reading. C. At 23 days of age, inadequate milk could have been ingested owing to a delay in the initial feeding. D. The biochemical buildup of serum phenylalanine is detectable after 23 days of milk or formula ingestion. Question 21. A 3-year-old child has had symptoms of influenza including fever, productive cough, nausea, vomiting, and sore throat for the past several days. In caring for a young child with symptoms of influenza, the mother must be cautioned about. Here are the options. Option A. Giving aspirin and bismuth subsalicylate Pepto-Bismol to treat the symptoms. Option B. Giving clear liquids too soon. Option C. Allowing the child to come in contact with other children for 3 days. Option D. The possibility of pneumonia as a complication. The correct answer is option A. Giving aspirin and bismuth subsalicylate Pepto-Bismol to treat the symptoms. Aspirin should never be given to children with influenza because of the possibility of causing Ray's syndrome. Pepto-Bismol is also classified as a salicylate and should be avoided. B. Depending on the severity of symptoms, the child may be receiving Roman 4 therapy or clear liquids. C. The disease has a 13-day incubation period and affected children are most infectious 24 hours before and after the onset of symptoms. D. Although viral pneumonia can be a complication of influenza, this would not be an initial priority. Question 22. A 10-year-old boy has been diagnosed with Legg-Calvé-Per's disease. Which of the client's responses would indicate compliance during initial therapy? Here are the options. Option A. Drinking large amounts of milk. Option B. Not bearing weight on affected extremity. Option C. Walking short distances 3 times/day. Option D. Putting self on weight reduction diet. The correct answer is option B. Not bearing weight on affected extremity. This condition causes aseptic necrosis of the head of the femur in the acetabulum. Drinking large quantities of milk at this time cannot hasten recovery. The aim of treatment is to keep the head of the femur in the acetabulum. Non-weight bearing is essential. Activity causes microfractures of the epiphysis. C. In addition to non-weight bearing, clients are often placed on bed rest, which helps to reduce inflammation. Later, active motion is encouraged. D. Weight is not generally an issue with this disease. Slipped femoral capital epiphysis, which is most frequently observed in obese pubescent children, usually requires a weight reduction diet. Question 23. A 7-year-old girl has been diagnosed with juvenile arthritis and has been placed on daily aspirin. Which statement made by the parent indicates a need for further teaching? Here are the options. Option A. My daughter takes her aspirin with her meals. Option B. Her gums have been bleeding frequently. Maybe she is brushing too hard. Option C. I give her aspirin on a regular schedule every day. Option D. One sign of aspirin toxicity can be ringing in the ears. The correct answer is option B. Her gums have been bleeding frequently. Maybe she is brushing too hard. Aspirin should not be given on an empty stomach because it is irritating to the mucosa. The bleeding from decreased clotting capacity may be caused by aspirin toxicity. C. A regular schedule of aspirin administration is important to maintain a satisfactory drug level in the body. D. Aspirin toxicity may affect cranial nerve Roman 8, leading to tinnitus ringing in the ears. Question 24. A young child has been placed in a spica cast. The chief concern of the nurse during the first few hours is, here are the options. Option A. Prevention of neurovascular complications. Option B. Prevention of loss of muscle tone. Option C. Immobilization of the affected limb. Option D. Using heated fans to dry the cast. The correct answer is option A. Prevention of neurovascular complications. Because the extremity may continue to swell and the cast could constrict circulation, the nurse should elevate the limb and observe for capillary refill, warmth, mobility of toes, and circulation. Although muscle tone may diminish over time in the affected limb, this is not the immediate concern. The limb has been immobilized already by the cast, and therefore immobilization is not a concern. D. Heated fans and dryers are discouraged because the outside cast will dry quickly, yet the area beneath the cast remains wet and could cause burns. Question 25. The pediatrician has diagnosed heniocarditis in an 8-year-old girl and has placed her on oral glycofulvin. The nurse should emphasize which of these instructions to the mother and/or child. Here are the options. Option A. Administer oral glycofulvin on an empty stomach for best results. Option B. Discontinue drug therapy if food tastes funny. Option C. May discontinue medication when the child experiences symptomatic relief. Option D. Observe for headaches, dizziness, and anorexia. The correct answer is option D. Observe for headaches, dizziness, and anorexia. Giving the drug with or after meals may allay gastrointestinal discomfort. Giving the drug with a fatty meal, ice cream, or milk increases absorption rate. B. Glycofulvin may alter taste sensations and thereby decrease the appetite. Monitoring of food intake is important, and inadequate nutrient intake should be reported to the physician. C. The child may experience symptomatic relief after 4,896 hours of therapy. It is important to stress continuing the drug therapy to prevent relapse, usually about 6 weeks. D. The incidence of side effects is low, however, headaches are common. Nausea, vomiting, diarrhea, and anorexia may occur. Dizziness, although uncommon, should be reported to the physician. Question 26. A 12-year-old girl has been diagnosed with insulin-dependent diabetes mellitus. Which of these principles would best guide her nutritional management? Here are the options. Option A. Concentrated sweets are taken during increased activity. Option B. Food restriction is imposed to reduce weight. Option C. Caloric distribution should be calculated to fit activity patterns. Option D. Fat requirements are increased owing to the possibility of ketoacidosis. The correct answer is option C. Caloric distribution should be calculated to fit activity patterns. Concentrated sweets are eliminated from diet planning. Complex carbohydrates may be taken at the time of increased activity. B. Food restriction is not used for diabetic control of growing children. Caloric restriction may be imposed for weight control if necessary. C. Total caloric intake and proportions of basic nutrients should be consistent from day to day. Distribution of these calories should fit the activity pattern. Extra food is needed for increased activity. A balance of food, exercise, and insulin should be maintained. D. Because of the increased risk of atherosclerosis, the fat percentage of the total caloric intake is reduced. Question 27. A 5-year-old has just had a tonsillectomy and adenoidectomy. Which of these nursing measures should be included in postoperative care? Here are the options. Option A. Encourage the child to cough up blood if present. Option B. Give warm, clear liquids when fully alert. Option C. Have child gargle and do toothbrushing to remove old blood. Option D. Observe for evidence of bleeding. The correct answer is option D. Observe for evidence of bleeding. The nurse should discourage the child from coughing, clearing the throat, or putting objects in his mouth. These may induce bleeding. B. Cool, clear liquids may be given when child is fully alert. Warm liquids may dislodge a blood clot. The nurse should avoid red or brown-colored liquids to distinguish fresh or old blood from ingested liquid should the child vomit. C. Gargles and vigorous toothbrushing could initiate bleeding. D. Postoperative hemorrhage, though unusual, may occur. The nurse should observe for bleeding by looking directly into the throat and for vomiting of bright red blood, continuous swallowing, and changes in vital signs. Question 28. A 4-week-old infant is admitted to the emergency room in respiratory distress. Which of the following statements indicates the nurse's knowledge of the anatomy of the respiratory system in pediatric clients? Here are the options. Option A. The diameter of the trachea is much smaller in children than in adults. Option B. The tongue is proportionally smaller in children than in adults. Option C. The pediatric airway is more rigid than that of the adults. Option D. The length of the pediatric airway is longer in children than in adults. The correct answer is option A. The diameter of the trachea is much smaller in children than in adults. A. The airway in children is much smaller than it is in adults. The diameter of the trachea in the newborn is 4 mm, and that of the adult is 20 mm. A small change in the diameter of the airway can make a major difference in the pediatric client. B. The tongue is proportionally larger in children and fills most of the oral cavity, thereby decreasing air space. C. The entire pediatric airway is elastic. Elasticity diminishes with age, however. D. The distances between respiratory structures are shorter than that of adults, and therefore organisms are able to move more rapidly down the throat, leading to more extensive respiratory involvement. Question 29. A 10-year-old has been diagnosed with acute post-streptococcal glomerulonephritis. The clinical findings were proteinuria, moderately elevated blood pressure, and periorbital edema. Which dietary plan is most appropriate for this client? Here are the options. Option A. Low-protein diet. Option B. Low-sodium diet. Option C. Increased fluid intake. Option D. High cholesterol diet. The correct answer is option B. Low-sodium diet. A high-protein diet is usually indicated because protein is excreted in urine. Protein restriction is usually prescribed with severe azotemia. B. The kidneys usually enlarge in these children and sodium and water are retained. C. Fluid restriction may be ordered to help reduce edema. However, monitoring for dehydration is indicated. D. A high cholesterol diet would not be indicated for any child, especially one with elevated blood pressure. Question 30. A 6-year-old girl has been diagnosed with a urinary tract infection secondary to vesicoureteral reflux. Which statement by her mother indicates a need for further teaching? Here are the options. Option A. I have taught her to wipe from front to back after urinating. Option B. I make sure she drinks plenty of fluids every day. Option C. She enjoys wearing nylon panties, but I make her change them every day. Option D. She tries to empty her bladder completely after she urinates, like I told her. The correct answer is option C. She enjoys wearing nylon panties, but I make her change them every day. A wiping from front to back is wiping from an area of lesser contamination urethra to an area of greater contamination rectum. B. Generous fluid intake reduces the concentration of urine. C. Cotton is a natural, absorbent fabric. Nylon often predisposes the client to urinary tract infections. Dark, warm, moist areas are excellent media for bacterial growth. D. With vesicoureteral reflux. Urine refluxes into the ureter during voiding and then returns to the bladder residual, which becomes a source for future infection. Question 31. A 1-year-old child is to receive an IM injection ordered by his pediatrician. He has fallen asleep in his mother's arms when the nurse approaches. Which approach is most appropriate at this time? Here are the options. Option A. Give the injection in the vastus lateralis site before the child awakens. Option B. Awaken the child first and give the injection in the ventrogluteal site. Option C. Awaken the child first and give the injection in the dorsogluteal site. Option D. Ask the mother to place the child on the examination table and leave the room, and then give the injection in an appropriate site. The correct answer is option B. Awaken the child first and give the injection in the ventrogluteal site. If awakened first, the child will know that nothing painful will be done without the child being alerted. B. The ventrogluteal site is a safe site for children because it is a large muscle free of major nerves and blood vessels. C. The dorsogluteal site is not recommended in children who have not been walking for at least 1 year because the muscle is not fully developed. D. The parent will be able to offer support and comfort during and after the injection. Question 32. The physician has ordered that ampicillin 250 mg Roman 4 be given over 30 minutes. The medication is diluted as recommended in 10 ml in the volume control chamber of a set that has a tubing of 12 ml. Which nursing measure is most accurate considering these facts? Here are the options. Option A. Infuse volume at 44 ml/hr. Option B. Infuse volume at 22 ml/hr. Option C. Infuse volume at 10 ml/hr. Option D. Infuse volume at 30 ml/hr. The correct answer is option A. Infuse volume at 44 ml/hr. The volume to be infused should be diluted medication volume added to the volume control chamber 10 ml plus the tubing volume 12 ml. The general formula for calculating Roman 4 medications for children is rate equals volume to be infused x administration set drop factor microdrop 60 GTTS/min desired time to infuse in minutes rate equals 10 plus 12 22 x 60 30 equals 44 ml/hr. B, C, D. These values are incorrect. Question 33. An infant weighing 15 lb has just been treated for severe diarrhea in the hospital. Discharge instructions by the nurse will include maintenance fluid requirements for the pediatric clients. Which of the following values best indicates the nurse's understanding of normal fluid requirements for this infant? Here are the options. Option A. 240 ml/day. Option B. 680 ml/day. Option C. 330 ml/day. Option D. 960 ml/day. The correct answer is option B. 680 ml/day. A, C, D. These answers are incorrect. B. Normal fluid requirement for this pediatric client is based on the fact that 0-10 kg of weight equals 100 ml/kg per day. This infant weighs 15 pounds 6.8 kg. Thus, 100 ml x 6.8 equals 680 ml/day. Question 34. A normal 3-year-old child is suspected of having meningitis. The doctor has ordered a lumbar puncture. In light of this procedure and developmental characteristics of this age group, which nursing measure is most appropriate? Here are the options. Option A. Emphasize those aspects of the procedure that require cooperation. Option B. Tell the child not to cry or yell. Option C. Tell the child that he will get a stick in his back. Option D. Use medical terminology when explaining the procedure to the client. The correct answer is option A. Emphasize those aspects of the procedure that require cooperation. The nurse should emphasize what is required to elicit cooperation and help to develop a sense of autonomy. B. The child may express discomfort verbally and should be encouraged to express his feelings. C. Selecting non-threatening words to explain a procedure will prevent misinterpretation. D. When explaining the procedure to the parent with the child present, the nurse should use words that the child can understand to avoid misunderstanding. Question 35. A mother brings a 6-month-old infant and a 4-year-old child to the nursing clinic for routine examination and screening. Which of these plans by the nurse would be most successful? Here are the options. Option A. Examine the 4-year-old first. Option B. Provide time for play and becoming acquainted. Option C. Have the mother leave the room with one child and examine the other child privately. Option D. Examine painful areas first to get them over with. The correct answer is option B. Provide time for play and becoming acquainted. If the 6-month-old should be examined first. If several children will be examined, begin with the most cooperative and less anxious child to provide modeling. B. Providing time for play and getting acquainted minimizes stress and anxiety associated with assessment of body parts. C. Children generally cooperate best when their mother remains with them. D. Painful areas are best examined last and will permit maximum accuracy of assessment. Question 36. An 11-month-old infant is admitted with a possible diagnosis of pyloric stenosis. Which of the following best describes the characteristic clinical manifestations of pyloric stenosis? Here are the options. Option A. Pain, especially when eating. Option B. Poor appetite and sucking reflex. Option C. Increased frequency and quantity of stools. Option D. Palpable olive-shaped mass in the epigastrium just right of the umbilical cord. The correct answer is option D. Palpable olive-shaped mass in the epigastrium just right of the umbilical cord. A. There is no evidence of pain in infants with pyloric stenosis whether eating or not. B. There are both good appetite and feeding habits in these children. C. Because of regurgitation, there is usually decreased frequency and quantity of stools and also signs of dehydration and weight loss. D. Along with upper abdominal distension, there is a characteristic palpable olive-shaped mass located to the right of the umbilicus. Question 37. As soon as a child has been diagnosed as hearing impaired, special education should begin. Which of the following special education tasks is the most difficult for a severely hearing impaired child? Here are the options. Option A. Auditory training. Option B. Speaking. Option C. Lip reading. Option D. Sighting. The correct answer is option B. Speech. With a slight and mild hard of hearing, auditory training is beneficial. B. Speech is the most difficult task because it is learned by visual and auditory stimulation, imitation, and reinforcement. C. D. Lip reading and signing are aimed at establishing communicative skills, but they are learned more easily by visual stimulation. Question 38. A 15-year-old child is admitted to the pediatric unit with a diagnosis of thalassemia. Which of the following would be included in educating the mother and child as part of discharge planning? Here are the options. Option A. Give oral iron medication every day. Option B. Have the child's blood pressure monitored every week. Option C. Know the signs and symptoms of iron overload. Option D. Keep exercise at a minimum to reduce stress. The correct answer is option C. Know the signs and symptoms of iron overload. Oral iron supplements are contraindicated in thalassemia. B. Although heart failure may be an end result of this disease, this action is unnecessary. C. Iron overload is a potential complication of frequent blood transfusions of children with thalassemia. D. Children should be encouraged to pursue activities related to their exercise tolerance. Question 39. An 8-year-old boy has been diagnosed with hemophilia. Which of the following diagnostic blood studies is characteristically abnormal in this disorder? Here are the options. Option A. Partial thromboplastin time. Option B. Platelet count. Option C. Complete blood count. Option D. Bleeding time. The correct answer is option A, partial thromboplastin time. A partial thromboplastic time measures activity of thromboplastin, which depends on the intrinsic clotting factors deficient in children who are hemophiliacs. B platelet counts are normal in hemophilia. C hemophilia does not affect the complete blood count. D bleeding times are normal in hemophiliacs. They measure the time interval for the bleeding from small superficial wounds to cease. Question 40. A murmur has been discovered during the routine physical examination of a 1-year-old child. The parent is extremely concerned about this diagnosis. Which of the following explanations by the nurse indicates understanding of this dysfunction? Here are the options. Option A. The blood shifts from the right to the left atrium. Option B. Surgical closure by suture or patch is recommended before school age. Option C. Most atrial septal defects close spontaneously. Option D. The child can be treated medically with antibiotics to prevent bacterial endocarditis. The correct answer is option B. Surgical closure by suture or patch is recommended before school age. A. Because the left atrial pressure is greater than right atrial pressure, oxygenated blood flows from the left to the right atria. B. Because of the risk of pulmonary obstructive diseases and congestive heart failure later in life. Surgery is usually performed between age 4 and 6 years, with essentially no operative mortality or post-operative complications. C. Many ventricular septal defects close spontaneously 2060% as a result of growth and proliferation of the muscular septum or formation of a membrane across the opening. D. This management is usually recommended with children with mild pulmonary stenosis. Question 41. An alcoholic client who is completing the inpatient segment of a substance abuse program was placed on disulfiram anti-abuse drug therapy. What should the nurse include in the discharge instructions? Here are the options. Option A. If disulfiram is taken and alcohol ingested, the client experiences nausea, vomiting, and elevated blood pressure. Option B. Disulfiram is most effective when prescribed as late as possible in a recovery program. Option C. Disulfiram works on the desensitization principle. Option D. The effects of disulfiram can be triggered by alcohol 5 days to 2 weeks after the drug is discontinued. The correct answer is option D. The effects of disulfiram can be triggered by alcohol 5 days to 2 weeks after the drug is discontinued. A. When alcohol is ingested with disulfiram therapy, the client experiences nausea, vomiting, and a potentially serious drop in blood pressure. B. Disulfiram is most successful when used early in the recovery process while the individual makes major lifestyle changes necessary for a long-term recovery. C. Disulfiram works on the classical conditioning principle. D. The effects of disulfiram can be felt when alcohol is ingested 12 weeks after disulfiram is discontinued. Question 42. An 82-year-old former restaurant owner walks to the nursing station and states, "I have to go." The restaurant opens at 11 a.m. Which response by the nurse is the most appropriate? Here are the options. Option A. Go back to your room. You do not own a restaurant. Option B. You are in the hospital now. Calm down. Option C. You once owned a restaurant. Tell me about it. Option D. It is snowing outside. The restaurant is closed. The correct answer is option C. You once owned a restaurant. Tell me about it. A. This response cuts off communication with the client. It does not address her feelings. B. Reality orientation frequently does not work alone. Feelings must be addressed. Telling a client to calm down is frequently ineffective. C. Reminiscence is used here to reorient and recall past pleasant events. Talking about the restaurant will allay anxiety. D. This response may confirm to the client that she indeed does still own a restaurant, buying into her confusion. Her feelings and anxiety require nursing intervention. Question 43. A 15-year-old female adolescent is frequently breaking the rules of the unit. She has left the unit and was found smoking in the bathroom and spending a large amount of time in the male ward. Which statement by the nurse would best explain to the teenager why she must follow the rules of the unit? Here are the options. Option A. It is not easy, but the rules must be followed so that everyone can get a fair chance. Option B. If you do not follow the rules, you will be transferred to the closed lock unit. Option C. You are not being fair to the other clients by getting them involved in your deviant behavior. Option D. Break the rules all you want, but don't get caught again. The correct answer is option A. It is not easy, but the rules must be followed so that everyone can get a fair chance. A. This statement acknowledges that it is difficult but is not threatening or punitive. B. This statement is threatening and describes specific punishment for further deviant behavior. C. This response elicits shame by blaming her for involving others. D. This response gives her permission to break the rules but indicates that getting caught is wrong. Question 44. A 45-year-old male client experiences a sense of depression because he has not yet achieved his life's goals. His career has not been satisfying. He is still looking for the right job. His wife spends too much money and his children seem to ignore him while being very selfish. He is tired of all of their attitudes and is considering buying a red Corvette convertible. While obtaining these data concerning the client's feelings about his life, the nurse is able to determine he is experiencing what psychological crisis according to Erikson stages. Here are the options. Option A. Identity versus role confusion. Option B. Integrity versus despair. Option C. Intimacy versus isolation. Option D. Generativity versus self-absorption. The correct answer is option D. Generativity versus self-absorption. A. Identity versus role confusion is experienced by adolescents making the transition from childhood to adulthood as they attempt to develop a sense of identity. B. Integrity versus despair is experienced by the elderly as they reflect on their life in an attempt to find meaning. C. Intimacy versus isolation is experienced by young adults as they establish intimate bonds of love and friendship. Degenerativity versus self-absorption is experienced by middle-aged adults as they fulfill life goals that involve family, career, and society. The client is experiencing this crisis. Question 45. A female client is anticipating a visit with her parents over the Thanksgiving holidays. She has recently begun experiencing periods of extreme shortness of breath, which her physician has labeled as panic attacks. Which of the following statements by the nurse would enhance therapeutic communication? Here are the options. Option A. Why do you feel this way? Option B. Tell me about your dislike for your parents. Option C. Don't worry, everything will be all right on your visit with your parents. Option D. Perhaps you and I can discover what produces your anxiety. The correct answer is option D. Perhaps you and I can discover what produces your anxiety. A. Asking the client to provide an explanation for her feelings is often intimidating. B. This response is probing and may make the client feel used and valued only for the information she can provide. C. This underrates the client's feelings and belittles her concerns. It may cause the client to stop sharing feelings for fear that they will be ridiculed. D. The emphasis is on working with the client. It shows that there is hope for change through collaboration. Question 46. A female client has experienced varying degrees of depression throughout her life. Now that she is postmenopausal, her depression has increased. She is unable to motivate herself to clean her house or even to get out of bed and get dressed in the morning. The client was begun on fluoxetine Prozac therapy. When educating her about fluoxetine, what might the nurse caution her about? Here are the options. Option A. A daily dose of fluoxetine may be taken in the morning or evening. Option B. Fluoxetine is not sedating. Therefore, restrictions on driving and other hazardous activities are not necessary. Option C. Rashes or pruritus usually occur early in the therapy and are treatable without discontinuing the medication. Option D. It is safe to take over-the-counter or other prescription medications with fluoxetine. The correct answer is option C. Rashes or pruritus usually occur early in the therapy and are treatable without discontinuing the medication. A daily dose of fluoxetine should be taken in the morning. Afternoon doses may cause nervousness and insomnia. B. Although fluoxetine is less sedating than other antidepressants, it may still cause dizziness or drowsiness in some clients. The nurse should caution clients to avoid driving or hazardous activities until the central nervous system effects of the drug are demonstrated. C. Rashes or pruritus do commonly occur early in therapy and respond to antihistamines or topical corticosteroids. D. Advise the client not to take over-the-counter or other prescription drugs without consulting with the physician. Fluoxetine does interact with other common drugs such as monoamine oxidase inhibitors, diazepam, insulin, oral antidiabetic agents, tricyclic antidepressants, and tryptophan. Question 47. A male client seeks counseling after his wife of 19 years threatened to divorce him. For most of their marriage, he has physically and verbally abused her. When asked about his behavior in the process of the nursing assessment, the client states, "I was mean to my wife because she insists on cooking meals and wearing clothes that I do not like." This defense mechanism is an example of, here are the options. Option A. Repression. Option B. Regression. Option C. Reaction formation. Option D. Rationalization. The correct answer is option D. Rationalization. A repression is blocking a desire from conscious expression. The client is conscious of his desires. B. Regression is returning to an earlier form of expression, which is not demonstrated here. C. Reaction formation is acting out the opposite of true feelings. The client felt anger concerning his wife's cooking and acted out his feelings. D. Rationalization is unconsciously falsifying an experience by giving a rational explanation. The client is attempting to justify his behavior by giving an explanation. Question 48. A male client is admitted to the psychiatric unit after experiencing severe depression. He states that he intends to kill himself, but he asks the nurse not to repeat his intentions to other staff members. Which response demonstrates understanding and appropriate action on the part of the nurse? Here are the options. Option A. I understand you're depressed, but killing yourself is not a reasonable option. Option B. We need to discuss this further, but right now let's complete these forms. Option C. Don't do that. You have so much to live for. You have a wonderful wife and children. The client in the next room has no one. Option D. This is very serious. I do not want any harm to come to you. I will have to report this to the rest of the staff. The correct answer is option D. This is very serious. I do not want any harm to come to you. I will have to report this to the rest of the staff. A. To the client, suicide may be a reasonable action and the only one he can cope with at this time. B. This response indicates to the client that his intention to commit suicide is not important to the nurse at this time. C. The client is so depressed that he is not able to see the positive aspects of his life. At no time should the nurse discuss another client's problems in conversation. D. This statement tells the client that the nurse recognizes his problem is of a serious nature and will take all steps necessary to help him. Question 49. During the admitting mental health assessment, a client demonstrates involuntary muscular activity. He has a marked facial tic around the mouth that is distracting to the nurse during the interview. The nurse recognizes the behavior and documents it as. Here are the options. Option A. Dyskinesia. Option B. Akathisia. Option C. Ekapraxia. Option D. Echolalia. The correct answer is option A. Dyskinesia. A. The client is demonstrating dyskinesia, which is involuntary muscular activity, such as tic, spasm, or myoclonus. B. Akathisia is regular rhythmic movements, usually of the lower limbs, such as constant motor restlessness. C. Ekapraxia is mimicking the movements of another person. D. Echolalia is mimicking the speech of another person. Question 50. A female client is seeking counseling for personal problems. She admits to being very unhappy lately at both home and work. During the nursing assessment, she uses many defense mechanisms. Which statement or action made by the client is an example of adaptive suppression? Here are the options. Option A. I did not get the raise because my boss does not like me. Option B. I felt a lump in my breast 2 weeks ago. I put off getting it checked until after my sister's wedding. Option C. My son died 3 years ago. I still cannot bring myself to clean out his room. Option D. My husband told me this morning that he wants a divorce. I am upset, but I cannot discuss the matter with him until after my company's board meeting today. The correct answer is option D. My husband told me this morning that he wants a divorce. I am upset, but I cannot discuss the matter with him until after my company's board meeting today. This statement is an example of adaptive rationalization. She is coping with her disappointment by rationalizing. This is adaptive because no harm is done to self or others. It is used to protect her ego. B. This is an example of maladaptive suppression. She is suppressing the seriousness of the lump. It is maladaptive because delaying treatment will cause harm to her. C. The client's actions are an example of maladaptive denial. She is denying her son's death by not facing his possessions. Until she faces his death, she cannot face reality. D. This is an example of adaptive suppression. She realizes the impact of her husband's statement but delays discussion until she can devote her full attention to the matter. Question 51. When interviewing parents who are suspected of child abuse, the nurse would use which of the following interview techniques? Here are the options. Option A. Be direct, honest, and attentive. Option B. Approach them in the emergency room as soon as you suspect abuse to clear the air right away. Option C. Ask the parents what they could have done differently to prevent this from happening to the child. Option D. After the interview, call Child Protective Services. The correct answer is option A. Be direct, honest, and attentive. A. The nurse must be honest, direct, professional, and attentive in her interview to gain the parents' trust. B. The nurse should approach the parents in private, away from the child. C. Asking them to relive and evaluate the situation may be looked at as placing blame on the parents for the child's accident. At this point, the parents may get defensive and stop communicating. D. Although you may call Child Protective Services, the nurse should inform the parents of their responsibility to do this and explain the process to them. Question 52. In an interview for suspected child abuse, the child's mother openly discusses her feelings. She feels her husband is too aggressive in disciplining their child. The child's father states, being a school custodian, I see kids every day that are bad because they did not get enough discipline at home. That will not happen to our child. Based on this remark, the nurse would make the following nursing diagnosis. Here are the options. Option A. Fear related to retaliation by the father. Option B. Actual injury related to poor impulse control by the father. Option C. Ineffective coping. Option D. Altered family process related to physical abuse. The correct answer is option D. Altered family process related to physical abuse. A. There is no evidence of fear as the child is unable to communicate. B. There is actual injury, but the parents had not yet admitted causing the child's injuries. C. This diagnosis is incomplete. There is no specific ineffective coping behavior identified in this nursing diagnosis. The altered family process best describes the family dynamics in this situation. The parents have admitted severe disciplinary action. Question 53. A 40-year-old client has lived for 8 years with an abusive spouse. She married her husband in her senior year of high school after becoming pregnant. Shortly after the baby was born, he began to physically abuse her. She has attempted to leave him several times, but she has always returned. She is unable to support herself financially, and her husband threatens to kill her if she leaves him. This time, her husband has beaten her so badly she cannot stop the bleeding from the gash above her eye. She admits her husband caused her injury. In assessing a person after experiencing spousal abuse, which need has the highest priority? Here are the options. Option A. Assess the level of anxiety, coping responses, and support systems. Option B. Assess the history of physical abuse. Option C. Assess suicide potential. Option D. Assess drug and alcohol use. The correct answer is option C. Assess suicide potential. Assessing the level of anxiety, coping responses, and support systems is very important, but not of highest priority at this time. B. A history of physical abuse is an important part of assessment. The nurses must also always ask if there is abuse of the children. C. Although all of these answers are very important in assessment, the highest priority is assessment of suicide potential, because this could cause the greatest harm to the client. Feeling there is no other way out, abused spouses may consider suicide. D. The spouse may be self-medicating herself with alcohol or drugs to escape an awful situation. The abuser may also be abusing drugs or alcohol. If this is so, the nurse should encourage the spouse to seek counseling and not to return to the home. Question 54. As a nurse in the emergency room, you receive an outside call from an elderly woman who states she has just been raped. She states, I know I must come to the hospital, but what do I do next? You advise her to call the police, then come to the hospital emergency room. What action by the nurse would indicate an understanding of the examination process once the victim enters the emergency room? Here are the options. Option A. Inform the victim not to wash, change clothes, douche, brush teeth, or eat or drink anything. Option B. Inform the victim to bring insurance information with her to the hospital so she can be properly cared for. Option C. Phone a rape counselor to begin working with the victim as soon as she enters the hospital. Option D. Do not leave the victim alone to collect her thoughts. The correct answer is option A. Inform the victim not to wash, change clothes, douche, brush teeth, or eat or drink anything. Providing the victim with these instructions will aid in the determination of physical evidence of rape. Victims frequently feel dirty after rape, and their first instinct is to take care of personal hygiene before facing anyone. This action is of lesser importance at this time. C. Although this is a nursing measure appropriate in this situation, contacting a counselor can be done once the victim enters the hospital. Frequently, victims call but do not follow up with a visit. D. Once the victim enters the emergency room, it is important not to leave her alone. Question 55. A 14-year-old teenager is demonstrating behavior indicative of an obsessive-compulsive disorder. She is obsessed with her appearance. She will not leave her room until her hair, clothes, and makeup are perfect. She always dresses immaculately. Recently, she expressed disgust over her appearance after she gained 5 lb. After observing a marked weight loss over a 2-week period, her mother suspects that she is experiencing bulimia. She eats everything on her plate, then runs to the bathroom. In interviewing the teenager, she discusses in great detail all of the events leading to her bulimia, but not her feelings. What defense mechanism is she using? Here are the options. Option A. Dissociation. Option B. Intellectualization. Option C. Rationalization. Option D. Displacement. The correct answer is option B. Intellectualization. A dissociation is separating a group of mental processes from consciousness or identity, such as multiple personalities. That is not evident in this situation. B. Intellectualization is excessive use of reasoning, logic, or words usually without experiencing associated feelings. This is the defense mechanism that this client is using. C. Rationalization is giving a socially acceptable reason for behavior rather than the actual reason. She is discussing events, not reasons. D. Displacement is a shift of the emotion associated with an anxiety-producing person, object, or situation to a less threatening object. Question 56. A male client is experiencing extreme distress. He begins to pace up and down the corridor. What nursing intervention is appropriate when communicating with the pacing client? Here are the options. Option A. Ask him to sit down. Speak slowly and use short, simple sentences. Option B. Help him to recognize his anxiety. Option C. Walk with him as he paces. Option D. Increase the level of his supervision. The correct answer is option C. Walk with him as he paces. The nurse should not ask him to sit down. Pacing is the activity he has chosen to deal with his anxiety. The nurse dealing with this client should speak slowly and with short, simple sentences. B. The client may already recognize the anxiety and is attempting to deal with it. C. Walk with the client as he paces. This gives support while he uses anxiety-generated energy. D. Increasing the level of supervision may be appropriate after he stops pacing. It would minimize self-injury and/or loss of control. Question 57. A 24-year-old graduate student recognizes that he has a phobia. He suffers severe anxiety when he is in darkness. It has altered his lifestyle because he is unable to go to a movie theater, concert, and other events that may require absence of light. The client is seeking assistance because he is no longer able to socialize with friends due to his phobia. The psychologist working with him is using desensitization. He has asked the nursing staff to assist the client in muscle relaxation techniques. What result would indicate client education has been successful? Here are the options. Option A. He enters a movie theater, sits in his chair, and replaces anxiety with relaxation as the theater darkens. Option B. He enters a concert, but as the lights dim, he does not experience anxiety. Option C. He states that he no longer fears dark places. Option D. He takes a part-time job as a photographic assistant. His job necessitates his working in a darkroom. The correct answer is option A. He enters a movie theater, sits in his chair, and replaces anxiety with relaxation as the theater darkens. This situation provides specific evidence that the client is able to integrate muscle relaxation technique into his lifestyle to alleviate anxiety. The client may not experience anxiety at the concert, but there is no evidence regarding the technique that he used to alleviate anxiety. C. The client may state he no longer experiences anxiety, but there is no evidence demonstrating this. He may be denying anxiety to discontinue therapy prematurely. D. Does he experience anxiety in the darkroom? He may have taken this job to force himself to deal with the phobia directly. Question 58. A female client has just died. Her family is requesting that all nursing staff leave the room. The family's religious leader has arrived and is ready to conduct a ceremony for the deceased in the room, requesting that only family members be present. The nurse assigned to the client should perform the appropriate nursing action, which might include, here are the options. Option A. Inform the family that it is the hospital's policy not to conduct religious ceremonies in client rooms. Option B. Refuse to leave the room because the client's body is entrusted in the nurse's care until it can be brought to the morgue. Option C. Tell the family that they may conduct their ceremony in the client's room, however, the nurse must attend. Option D. Respect the client's family's wishes. The correct answer is option D. Respect the client's family's wishes. It is rare that a hospital has a specific policy addressing this particular issue. If the statement is true, the nurse should show evidence of the policy to the family and suggest alternatives, such as the hospital chapel. The refusal to leave the room demonstrates a lack of understanding related to the family's need to grieve in their own manner. C. The nurse should leave the room and allow the family privacy in their grief. D. The family's wish to conduct a religious ceremony in the client's room is part of the grief process. The request is based on specific cultural and religious differences dictating social customs. Question 59. A female client has been recently diagnosed as bipolar. She has taken lithium for the past several weeks to control mania. What must be included in client's education regarding lithium toxicity? Here are the options. Option A. Maintain a normal diet, however, limit salt intake to no more than 3 g/day. Option B. Take lithium between meals to increase absorption. Option C. Withhold lithium if experiencing diarrhea, vomiting, or diaphoresis. Option D. For pain or fever, avoid aspirin or acetaminophen Tylenol. Non-steroidal anti-inflammatory drugs are preferred. The correct answer is option C. Withhold lithium if experiencing diarrhea, vomiting, or diaphoresis. The client should maintain a normal diet, including normal salt intake. A low-sodium diet can cause lithium retention, leading to toxicity. The lithium must be taken with meals because it is irritating to the gastric mucosa. C. Diarrhea, vomiting, or diaphoresis can cause dehydration, which will increase lithium blood levels. If these symptoms occur, the nurse should instruct the client to withhold lithium. D. Lithium is not to be taken with over-the-counter drugs without specific instruction. Some drugs raise lithium levels, whereas others lower lithium levels. Question 60. For the past several months, an elderly female client with Alzheimer's disease has experienced paranoia, hallucinations, and aggressive, disruptive behavior. The family is utilizing haloperidol as needed to control her behavior. On nursing assessment, you note that the client demonstrates involuntary movements of the tongue and fingers. This may most likely indicate, here are the options. Option A. Tardive dyskinesia, which may be a side effect of antipsychotic medication. Option B. Early symptoms of Parkinson's disease. Option C. A more advanced stage of Alzheimer's disease than previously experienced by the client. Option D. The need to change her medication from haloperidol to another antipsychotic drug to lessen symptoms. The correct answer is option A. Tardive dyskinesia, which may be a side effect of antipsychotic medication. A tardive dyskinesia is a common side effect of antipsychotic medications, such as haloperidol. Discontinuing the medication can alleviate symptoms. B. Although mild tremors are an early sign of Parkinson's disease, haloperidol must be discontinued first and the client further evaluated. C. These symptoms do not necessarily indicate a more advanced stage of Alzheimer's disease. D. Most antipsychotic drugs are chemically similar and will produce the same side effects. Question 61. A 32-year-old male client is a marketing representative. His job requires him to have a tremendous amount of energy during the day. He frequently uses cocaine to sustain his energy level. Lately, he has increased his use of cocaine and even experimented with crack cocaine. Realizing he can no longer continue this destructive behavior, he is seeking treatment for cocaine addiction. In planning nursing care for the client's inpatient stay, which expected outcome is most appropriate? Here are the options. Option A. He will attend 4 consecutive group educational sessions on substance abuse. Option B. He will name activities that he would most likely be involved in post-treatment. Option C. He will meet with his family in counseling sessions and discuss his feelings. Option D. He will be able to deal with his feelings through participation in group therapy sessions. The correct answer is option D. He will be able to deal with his feelings through participation in group therapy sessions. A. This expected outcome is specific as related to attendance, but not specific as related to outcome criteria. B. Stating activities does not guarantee involvement. C. This goal may help the recovery process, but post-counseling behavior is not addressed. D. This statement best describes the expected outcome. The client will be attending group therapy sessions and through them he will deal with his feelings. Question 62. A client has been instructed in how to take her nitroglycerin tablets. The nurse giving her instructions knows the client understands the information when she tells her. Here are the options. Option A. I should contact my physician if I have headaches after I take this medicine. Option B. I should keep the tablets in the refrigerator. Option C. I should call the doctor if 3 doses of the medicine do not relieve my pain. Option D. I should take these with water but not with milk. The correct answer is option C. I should call the doctor if 3 doses of the medicine do not relieve my pain. A headaches may occur after taking nitroglycerin because of vacillation. B. The tablets do not need to be refrigerated. The client should carry them with her. C. The client should contact the physician if repeated doses of nitroglycerin do not relieve the discomfort. D. Nitroglycerin tablets should be dissolved under the tongue. not swallowed. Question 63. A client has renal failure. Today's lab values indicate he has an elevated serum potassium. What additional priority information does the nurse need to obtain? Here are the options. Option A. Evaluation of his level of consciousness. Option B. Evaluation of an electrocardiogram. Option C. Measurement of his urine output for the past 8 hours. Option D. Serum potassium lab values for the last several days. The correct answer is option B. Evaluation of an electrocardiogram. If the level of consciousness is not affected by elevated potassium levels, B. An electrocardiogram (EKG) can tell the nurse whether this client is experiencing any cardiac dysfunction or arrhythmias related to the elevated potassium level. C. Measurement of the urine output is not a priority nursing action at this time. D. The client's serum potassium values for the past several days may provide information about his renal function, but they are not a priority at this time. Question 64. A client's wife is concerned over his behavior in recent months. He has been diagnosed with Parkinson's disease, and she is telling his nurse that he has been doing strange things. The nurse reassures the wife that the following behavior is normal with Parkinson's disease. Here are the options. Option A. Your husband will experience some periods of muscle flaccidity. Be sure to make him sit down during these periods. Option B. Your husband may move his hands in motions that look like he is rolling a pill between his fingers. Option C. Twitching of the muscles is to be expected and can occur at any time during the day. Option D. Parkinson's disease causes severe pain in the joints. You should give your husband Tylenol at those times. The correct answer is option B. Your husband may move his hands in motions that look like he is rolling a pill between his fingers. A client with Parkinson's disease generally experience stiffness and rigid movement. The pill rolling movements are a symptom experienced by the Parkinson client. C. Twitching of the muscles is not an expected symptom of Parkinson's disease. D. Parkinson's disease does not cause joint pain. Mild muscular pain may be present. Question 65. A male client tells his nurse that he has had an ulcer in the past and is afraid it is flaring up again. The nurse begins to ask him specific questions about his symptoms. The nurse knows that a symptom that might indicate a serious complication of an ulcer is. Here are the options. Option A. Pain in the middle of the night. Option B. A bowel movement every 35 days. Option C. Malaria. Option D. Episodes of nausea and vomiting. The correct answer is option C. Malaria. A client with ulcers generally experience abdominal pain. It is common to have pain in the early morning hours with an ulcer. The constipation is not a symptom associated with ulcers and would indicate a need to look at other factors. C. Malaria is blood in the stools. This could indicate a slow bleeding ulcer, which could result in significant amounts of blood loss over time. D. Nausea and vomiting may be present as a result of the ulcer, especially if it is a gastric ulcer. This does not indicate an immediate life-threatening complication. Question 66. A client has chronic obstructive pulmonary disease. She is slowly losing weight and her daughter is very concerned about increasing her nutrition. The nurse helps the daughter devise a plan of care for her mother. The plan of care should include which of the following interventions to promote nutrition. Here are the options. Option A. Offer her oral hygiene before and after meals. Option B. Encourage her to consume milk products. Option C. Encourage her to engage in an activity before a meal to stimulate her appetite. Option D. Restrict her fluid intake to 3 glasses of water a day. The correct answer is option A. Offer oral hygiene before and after meals. Clients with respiratory diseases are generally mouth breathers. Cleaning the oral cavity may improve the client's appetite, increase her feelings of well-being, and remove the taste and odor of sputum. Milk causes thick sputum, therefore, milk products would not be beneficial for this client. Exercise prior to a meal would require increased O2 consumption and most likely would decrease the client's ability to eat. Clients with respiratory diseases need increased fluid to liquefy secretions. Question 67. A female client is concerned that she is in a high-risk group for the development of acquired immunodeficiency syndrome (AIDS). She wants to know about the advisability of donating blood. Which of the following responses is correct? Here are the options. Option A. Individuals who donate blood are at risk of getting the AIDS virus. You should not donate. Option B. It's okay for you to donate because the blood bank has a test that is 100% effective. Option C. You should not donate since it takes time to develop antibodies to the AIDS virus. If you donate blood before you develop the antibody, you could pass it on in the blood. Option D. It is not a good idea for you to donate. If you have AIDS, the information is made public and could destroy your personal life. The correct answer is option C. You should not donate since it takes time to develop antibodies to the AIDS virus. If you donate blood before you develop the antibody, you could pass it on in the blood. The AIDS virus cannot be transmitted to the donor through the blood donation procedure. B. The test for the AIDS virus is not absolutely foolproof. Therefore, it is not wise for a person with known risk factors to donate blood. C. It takes time for antibodies to the AIDS virus to develop. An infected individual could donate contaminated blood without it testing positive for the virus. D. For reasons of confidentiality, information about individuals infected with AIDS is not made public. Question 68. A 50-year-old male client is to receive chemotherapy. The physician's orders include antiemetics. When planning his care, the nurse should take into consideration that antiemetics are best administered in the following way. Here are the options. Option A. Give antiemetics when nausea is experienced and continue on a regular schedule for 1,224 hours. Option B. Give antiemetics prior to the client receiving chemotherapy and continue on a regular basis for at least 2,448 hours after chemotherapy. Option C. Give antiemetics one at a time because combinations of antiemetics cause overwhelming side effects. Option D. Give antiemetics intermittently during the entire course of chemotherapy. The correct answer is option B. Give antiemetics prior to the client receiving chemotherapy and continue on a regular basis for at least 2,448 hours after chemotherapy. Nausea is more difficult to control if antiemetics are withheld until nausea is experienced. Antiemetics should be given prophylactically at the beginning of chemotherapy and continued on an around-the-clock basis to prevent nausea. Combinations of antiemetics give the best control for nausea by blocking various causes of nausea induced by chemotherapy. Antiemetics should be given around the clock during the course of chemotherapy. This prevents nausea from developing and prevents anticipatory nausea during subsequent chemotherapy administrations. Question 69. A 30-year-old female client is receiving antineoplastic chemotherapy. Which of the following symptoms should especially concern the nurse when caring for her? Here are the options. Option A. Respiratory rate of 16 breaths/min. Option B. Pulse rate of 80 bpm. Option C. Complaints of muscle aches. Option D. A sore throat. The correct answer is option D. A sore throat. A respiratory rate of 16 breaths/min is normal and is not a cause for alarm. A pulse rate of 80 bpm is normal and is not a cause for alarm. C. Complaints of muscle aches are unrelated to her receiving chemotherapy. There may be other causes related to her hospital stay or the disease process. D. A sore throat is an indication of a possible infection. A client receiving chemotherapy is at risk of neutropenia. An infection in the presence of neutropenia can result in a life-threatening situation. Question 70. 7 days ago, a 45-year-old female client had an ileostomy. She is self-sufficient and well otherwise. Which of the following long-term objectives would be unrealistic? Here are the options. Option A. She should be able to control evacuation of her bowels. Option B. She should be able to return to a regular diet. Option C. She should be able to resume sexual activity. Option D. She should be able to manage her own care. The correct answer is option A. She should be able to control evacuation of her bowels. Because of the location of an ileostomy, the client will not be able to control the evacuation of her bowels. The ileostomy will drain liquid stool continuously. The client should be able to return to a normal, well-balanced diet. She should avoid foods that cause diarrhea or excessive gas production, and she should eat small meals. The client should be able to resume sexual activity. She will be able to wear a pouch. The client has no other health or mental problems and should be able to manage her own ileostomy. Question 71. A 26-year-old client has no children. She has had an abdominal hysterectomy. In the first 24 hours postoperatively, the nurse would be concerned if the client. Here are the options. Option A. Cries easily and says she is having abdominal pain. Option B. Develops a temperature of 102 F. Option C. Has no bowel sounds. Option D. Has a urine output of 200 ml for 4 hours. The correct answer is option B. Develops a temperature of 102 F. The client may be more tearful than normal due to the stress of the surgery and its implications for her future life. She would be expected to have pain following surgery. A temperature of 102 F indicates an infectious process. This is not a normal sequence to surgery and indicates a need for further assessment. The client is expected to have no bowel sounds for 2,448 hours after surgery because of the trauma to the bowel. Normal urine output is 30 ml/hr. This represents an output of 50 ml/hr, which is greater than normal. Question 72. A 44-year-old female client is receiving external radiation to her scapula for metastases of breast cancer. Teaching related to skin care for the client would include which of the following? Here are the options. Option A. Teach her to completely clean the skin to remove all ointments and markings after each treatment. Option B. Teach her to cover broken skin in the treated area with a medicated ointment. Option C. Encourage her to wear a tight-fitting vest to support her scapula. Option D. Encourage her to avoid direct sunlight on the area being treated. The correct answer is option D. Encourage her to avoid direct sunlight on the area being treated. A. The skin in a treatment area should be rinsed with water and patted dry. Markings should be left intact, and the skin should not be scrubbed. B. Client should avoid putting any creams or lotions on the treated area. This could interfere with treatment. C. Radiation therapy clients should wear loose-fitting clothes and avoid tight, irritating fabrics. D. The area of skin being treated is sensitive to sunlight, and the client should take care to prevent sun damage by avoiding direct sunlight and covering the area when she is in the sun. Question 73. A male client is being treated in the burn unit for third-degree burns on his head, neck, and upper chest received in the last 24 hours. The nurse is evaluating the effectiveness of fluid resuscitation. Which of the following indicates effective fluid balance? Here are the options. Option A. His weight increases from 165 to 175 lb. Option B. His urine output is equal to his total fluid intake. Option C. His urine output has been 35 ml/hr for the past 12 hours. Option D. His blood pressure is 94/62. The correct answer is option C. His urine output has been 35 ml/hr for the past 12 hours. A weight gain of 10 lb represents a state of overhydration. B. He is losing fluids through insensible losses. A urine output equal to his intake indicates that he is receiving too little fluids. C. A urine output greater than his intake indicates that he is receiving adequate fluid resuscitation to account for urinary and insensible losses. D. A blood pressure of 94/62 indicates a state of underhydration and inadequate circulatory volume. Question 74. A 24-year-old male client is admitted with a diagnosis of sickle cell anemia. The nurse discusses his disease with him and emphasizes the following information. Here are the options. Option A. He should monitor his sputum, stools, and urine for signs of bleeding. Option B. His daily diet should include a large amount of fluid. Option C. He should not be concerned about having to fly on a commuter airplane on a weekly basis. Option D. He should not worry about having children because this disease is passed on only by female carriers. The correct answer is option B. His daily diet should include a large amount of fluid. A bleeding is not a symptom of sickle cell anemia or sickle cell crisis. B. Decreased blood viscosity leads to sickling of red blood cells. Increased fluid intake maintains adequate circulating blood volume and decreases the chance of sickling. C. Hypoxia leads to sickling of cells. Flying in non-pressurized planes places the client in a situation of low O2 tension, which can lead to sickling. D. Male and female clients with sickle cell disease can pass the trait on to their offspring. Therefore, this client should receive genetic counseling prior to having children. Question 75. A female client has been diagnosed with chronic renal failure. She is a candidate for either peritoneal dialysis or hemodialysis and must make a choice between the two. Which information should the nurse give her to help her decide? Here are the options. Option A. Hemodialysis involves less time to filter the blood, but the client must consider travel time, distance, and inconvenience. Option B. Hemodialysis involves more time to filter the blood than does peritoneal dialysis. Option C. Peritoneal dialysis has almost no complications and is less time-consuming than hemodialysis. Therefore, it is preferred. Option D. Peritoneal dialysis requires that a home health nurse prepare and administer the treatments. The correct answer is option A. Hemodialysis involves less time to filter the blood, but the client must consider travel time, distance, and inconvenience. A hemodialysis is faster in clearing the blood of toxins than peritoneal dialysis. However, clients must consider the time that they spend traveling to the dialysis center and the disruption in their daily lives. B. Peritoneal dialysis requires several exchanges with dwelling time for the dialysate and therefore takes longer than hemodialysis. C. Several serious complications of peritoneal dialysis include peritonitis, catheter displacement, and or plugging, or pain during dialysis. D. A client can be taught to self-administer peritoneal dialysis without the aid of a professional. Question 76. A female client decides on hemodialysis. She has an internal vascular access device placed. To ensure patency of the device, the nurse must. Here are the options. Option A. Assess the site for leakage of blood or fluids. Option B. Auscultate the site for bruit. Option C. Assess the site for bruising or hematoma. Option B. Inspect the site for color, warmth, and sensation. The correct answer is option B. Auscultate the site for a bruit. A BIS is an internal device. Assessment of the site should include assessing for swelling, pain, warmth, and discoloration. This measure does not assess patency. The presence of a bruit indicates good blood flow through the device. C. The nurse should inspect the site for bruising or hematoma. However, this measure does not assure patency of the device. D. The nurse should inspect the vascular access site frequently for signs of infection. However, this does not assure patency. Question 77. A client is receiving peritoneal dialysis. He has been taught to warm the dialyzing fluid prior to instilling it because. Here are the options. Option A. Warm solution helps keep the body temperature maintained within a normal range during installation. Option B. Warm solution helps dilate the peritoneal blood vessels. Option C. Warm solution decreases the risk of peritoneal infection. Option D. Warm solution promotes a relaxed abdominal muscle. The correct answer is option B. Warm solution helps dilate the peritoneal blood vessels. Instilling a cool solution does not significantly lower the body temperature during peritoneal dialysis. B. Warm solution does help dilate the peritoneal blood vessels, facilitating the exchange of fluids. C. Warming the dialysate does not decrease the risk of peritoneal infection. Sterile technique decreases this risk. D. Relaxing the abdominal muscles does not facilitate peritoneal dialysis. Question 78. A female client is exhibiting signs of respiratory distress. Which of the following signs indicate a possible pneumothorax? Here are the options. Option A. Crackles or rails on the affected side. Option B. Bradypnea and bradycardia. Option C. Shortness of breath and sharp pain on the affected side. Option D. Increased breath sounds on the affected side. The correct answer is option C. Shortness of breath and sharp pain on the affected side. With a pneumothorax, air occupies the pleural space. Crackles or rails are heard with increased fluid or secretions and would not be present with air in the space. With a pneumothorax, the client would experience tachypnea and tachycardia to compensate for the decrease in oxygenation. Symptoms of pneumothorax include shortness of breath, sharp pain on the affected side with movement or coughing, asymmetrical chest expansion, and diminished or absent breath sounds on the affected side. D. With a pneumothorax, breath sounds would be decreased on the affected side indicates air in the pleural space. Question 79. A female client has a chest tube placed. It is accidentally pulled out of the intrapleural space when she is ambulating. The first action the nurse should take is to. Here are the options. Option A. Instruct the client to cough deeply to re-expand her lung. Option B. Put on sterile gloves and replace the tube. Option C. Apply a petrolatum dressing over the site. Option D. Auscultate the lung to determine if she needs the tube replaced. The correct answer is option C. Apply a petrolatum dressing over the site. If this action is inappropriate, coughing will not re-expand the lung and could result in further harm. B. This action is a medical procedure, not a nursing procedure. C. An occlusive dressing will prevent further air leak until the physician institutes further treatment. D. The decision to reinsert the tube is a medical decision, not a nursing one. Question 80. A male client has heart failure. He has been instructed to gradually increase his activities. Which signs and symptoms of worsening heart failure should the nurse tell him to watch for that would indicate a need for him to lower his activity level? Here are the options. Option A. Pain in his legs when he walks. Option B. Thirst, weight loss, and polyuria. Option C. Drowsiness and lethargy after his activities. Option D. Weight gain, edema in his lower extremities, and shortness of breath. The correct answer is option D. Weight gain, edema in his lower extremities, and shortness of breath. A pain in the legs could be indicative of doing too much too quickly, but none of worsening heart failure. The client should be cautioned to increase his activities slowly. The thirst, weight loss, and frequent urination are not indicative of heart failure. The client should report these symptoms to his physician. C. Drowsiness and lethargy are not indicative of worsening heart failure. The client should report these symptoms to his physician. D. All of these symptoms indicate a worsening cardiac condition possibly associated with too much activity. The client's activity level should be evaluated. Question 81. A male client is undergoing cardiac tests. He has been instructed to wear a Holter monitor. The nurse knows she has included the appropriate information in her teaching when the client tells her. Here are the options. Option A. He should remove the electrodes for bathing. Option B. Damage to his heart muscle will be recorded by the monitor. Option C. He is to keep a record of everything he does during the day. Option D. He is to refrain from activities that cause chest pain. The correct answer is option C. He is to keep a record of everything he does during the day. A. The client should leave the electrodes in place during the entire time the test is ordered. He should not even remove the electrodes for bathing. B. The Holter monitor will record cardiac electrical activity but will not record damage to his myocardium. C. The client should keep a record of all of his activities so the physician can correlate the ECG findings with his activities. D. The client should continue doing his regular activities. The purpose of the Holter monitor is to record heart activity during routine activities. Question 82. To prevent thrombophlebitis in a client on complete bed rest, the nursing care plan should include. Here are the options. Option A. Dangle the client's legs over the edge of the bed every shift. Option B. Massage the client's calves briskly every shift. Option C. Keep the client's legs extended and discourage any movement. Option D. Have the client tighten and relax leg muscles several times daily. The correct answer is option D. Have the client tighten and relax leg muscles several times daily. Dangling the client's legs over the edge of the bed will contribute to stasis and pooling of blood and increases the risk of thrombus formation. Massaging the client's calves could result in dislodging and embolus. Decreased movement will contribute to pooling of blood and increased risk of venous thrombosis. Tightening and relaxing leg muscles increases circulation and decreases the risk of venous thrombosis. Question 83. A 78-year-old female client has a total hip arthroplasty. Her nurse should know that which of the following is contraindicated. Here are the options. Option A. Encourage exercises in the unaffected extremities. Option B. Encourage her to cross and uncross her legs. Option C. Check neurological and circulatory status of the affected leg hourly. Option D. Place a trochanter roll along the upper thigh of the affected leg. The correct answer is option B. Encourage her to cross and uncross her legs. Exercising the unaffected extremities will prevent contractures and emboli. B. Crossing and uncrossing the affected leg after surgery can dislocate the joint. C. Neurological and circulatory status of the affected leg has been compromised by surgery. Hourly checks are needed to monitor the status of the leg. D. A trochanter roll will prevent the upper thigh from rolling outward, increasing the chances of dislocation. Question 84. A male client has a history of diverticulosis. He has questions about the foods that he should eat. His nurse gives him the following information. Here are the options. Option A. He should be on a high-fiber diet. Option B. He should eat a low-residue diet. Option C. He should drink minimal amounts of fluids. Option D. He does not need to make any modifications. The correct answer is option A. He should be on a high-fiber diet. A client with diverticulosis should maintain a high-fiber diet and prevent constipation with bran or bulk laxatives. Low-residue diets lead to constipation and are contraindicated in clients with diverticulosis. C. Clients with diverticulosis should drink at least 8 glasses of water each day to prevent constipation. D. Clients with diverticulosis should modify their diet to include high-fiber foods and bulk laxatives. Question 85. A term neonate has experienced no distress at birth and has an APGAR score of 9. Her mother has asked to breastfeed her following delivery. Immediately after birth, the neonate was most susceptible to heat loss. The most appropriate intervention to conserve heat loss and promote bonding is to. Here are the options. Option A. Place her under the radiant warmer. Option B. Dry her with blankets. Option C. Place her to her mother's breast. Option D. Place her on a heated pad. The correct answer is option C. Place her to her mother's breasts. A radiant warmer maintains an optimal thermal environment by use of a thermal skin sensor taped to the infant. The warmer limits parental attachment, so, although appropriate, it is not an intervention that promotes infant attachment. The warmed blankets prevent heat loss in the neonate by conduction. In addition, tactile stimuli promote crying and lung expansion. This intervention does not promote attachment, however. Skin-to-skin contact is an effective way to conserve heat after delivery and promotes parental attachment following birth in the healthy term infant. The first period of reactivity lasts approximately 30 minutes following birth. A strong sucking reflex and an active, awake newborn characterize this period. Surfaces of objects warmer than the infant promote overheating by conduction, and neonatal hyperthermia may result. Question 86. A client who is gravital 1 para 1 vaginally delivered a 7 lb girl. She received a midline episiotomy at delivery. When assessing the level of her uterus immediately following delivery, the nurse would expect the fundus to be located. Here are the options. Option A, at the umbilicus. Option B, at the symphysis pubis. Option C, midway between the umbilicus and the xiphoid process. Option D, midway between the umbilicus and the symphysis pubis. The correct answer is option D, midway between the umbilicus and the symphysis pubis. Within 12 hours of delivery, the fundus of the uterus rises to or slightly above or below the umbilicus. Fundal height generally decreases 1 finger breadth, or 1 cm/day. B. The uterus descends into the pelvic cavity at approximately 1012 postpartal days and can no longer be palpated abdominally. C. Within 12 hours of delivery, the fundus of the uterus rises to or slightly above or below the umbilicus. Fundal height generally decreases 1 finger breadth, or 1 cm/day. An enlarged uterus may indicate subinvolution or postpartal hemorrhage. D. Immediately following delivery, the uterus lies midline, about midway between the umbilicus and the symphysis pubis. Question 87. A 19-year-old primigravida is admitted to the labor and delivery suite of the hospital. Her husband is accompanying her. The couple tells the nurse that this is the first hospital admission for her. The client's vaginal exam indicates she is 3 cm dilated, 80% effaced, and at 0 station. Based on the vaginal exam, she is in. Here are the options. Option A, Stage 2, latent phase. Option B, Stage 1, active phase. Option C, Stage 3, transition phase. Option D, Stage 1, latent phase. The correct answer is option D, Stage 1, latent phase. The second stage of labor is from full cervical dilation through birth of the baby. The 3 phases of this stage include latency or resting, descent, and final transition. The client is less than fully dilated, so she is not in stage 2. B. The first stage of labor begins with regular uterine contractions and continues until the woman is 10 cm dilated. The 3 phases of this stage include the early or latent phase 0-3 cm, the active phase 47 cm, and the transitional phase 710 cm. The client is 4 cm dilated, so she is in the latent phase of the first stage of labor. C. The third stage of labor is from the birth of the baby until the delivery of the placenta. The client is less than fully dilated. D. The first stage of labor begins with regular uterine contractions and continues until the woman is 10 cm dilated. The 3 phases of this stage include the early or latent phase 0-3 cm, the active phase 47 cm, and the transitional phase 710 cm. The client is 4 cm dilated, so she is in the latent phase of the first stage of labor. Question 88. A client is pregnant for the 4th time and has had 3 normal vaginal deliveries. She is in active labor and fully dilated. Suddenly she calls, "Nurse, the baby is coming." As the nurse responds to her call, which one of the following observations should the nurse make first? Here are the options. Option A, inspect the perineum. Option B, time the contractions. Option C, prepare a sterile area for delivery. Option D, auscultate for fetal heart rate FHR. The correct answer is option A, inspect the perineum. The nurse must assess the labor status to determine if birth is imminent. The nurse may note perineal bulging, crowning, or birth of the head to ascertain labor status. B. Assessing uterine contractions is one intervention to ascertain labor status. Based on the client's cry, it is not the intervention of choice. C. If delivery of the infant is imminent, preparing a clean or sterile area for delivery is appropriate, but labor status must be established, whether delivery is imminent, by perineal assessment. D. Assessing FHR is one intervention to ascertain fetal well-being. Based on the client's cry, this is not the intervention of choice. Question 89. A client has just received an epidural block. She is laboring on her right side. The nurse notes that her blood pressure has dropped from 132/68/78/42 mmHg. The nurse's first action would be to. Here are the options. Option A. Call the physician immediately and give dopamine IM. Option B. Turn her on her left side and recheck her blood pressure in 5 minutes. Option C. Administer oxytocin pitocin immediately and increase the rate of Roman 4 fluids. Option D. Increase the rate of Roman 4 fluids and start O2 by mask. The correct answer is option D. Increase the rate of Roman 4 fluids and start O2 by mask. A nursing measures to support fetal oxygenation and promote maternal blood pressure would precede calling the physician. B. Systolic pressures below 100 mmHg or a reduction in the systolic pressure of 30% necessitate treatment. Assessing the blood pressure in 5 minutes may allow for further fetal and signs or maternal compromise. Turning the client on her left side will promote uteroplacental perfusion and is appropriate. C. Oxytocin pitocin increases the strength of uterine contractions and may cause maternal hypotension. Thus, it is an inappropriate drug for use in this clinical situation. Roman 4 fluids would be increased to expand the circulating blood volume and promote increased blood pressure. D. Turning the mother to her left lateral side promotes uteroplacental perfusion. Roman 4 fluids are administered to increase the circulating blood volume, and O2 is administered to promote fetal oxygenation and decrease the nausea accompanying the hypotension. Question 90. A 28-year-old client comes to the clinic for her first prenatal examination. In relating her obstetrical history, she tells the nurse that she has been pregnant twice before. She had a miscarriage with the first pregnancy after 6 weeks. With this second pregnancy, she delivered twin girls at 31 weeks gestation. One of the twins was stillborn and the other twin died at 4 days of age. Using a 5-digit system, the nurse records her as being. Here are the options. Option A. 2-0-2-1-0. Option B. 2-2-2-1-2. Option C. 3-0-1-1-0. Option D. 2-1-1-0-0. The correct answer is option C. 3-0-1-1-0. The first digit represents the total number of pregnancies. This client has been pregnant 3 times, including this pregnancy. The twin pregnancy counts as only one pregnancy, and because she delivered prior to 37 weeks gestation, the third digit is recorded as 1. B. The first digit represents the total number of pregnancies. This client has been pregnant 3 times, including this pregnancy. The second digit represents the total number of full-term deliveries. She has lost 2 pregnancies before 37 weeks gestation. At present, she has no living children, so the 5th digit is noted as 0. C. The client is pregnant for the 3rd time. and the first digit reflects the total number of pregnancies. She has had no full-term deliveries because she delivered prior to 37 gestational weeks, so the second digit is recorded as 0. The third digit represents the number of preterm deliveries, and a twin pregnancy counts as only one delivery. She lost an earlier pregnancy prior to 20 gestational weeks, and the fourth digit reflects spontaneous or elective abortions. Lastly, the fifth digit indicates the number of children currently living, and she has no living children. D. She is pregnant for the third time, and the first digit reflects the total number of pregnancies. In the previous 2 pregnancies, she delivered prior to 37 gestational weeks, thus having no full-term deliveries, which is indicated by the second digit. The fourth digit represents the total number of abortions, spontaneous or elective, and she reported a spontaneous abortion with her first pregnancy. Question 91. A 22-year-old client is 16 weeks pregnant. She and her husband are expecting their first baby. The client tells the nurse that her last normal menstrual period was February 16, with 3 days of spotting on February 17, 18, and 19. The nurse calculates her expected date of delivery to be. Here are the options. Option A, November 23rd. Option B, December 26. Option C, September 14. Option D, December 9th. The correct answer is option A, November 23rd. A nails rule is as follows. Add 7 days to the first day of the last menstrual period, subtract 3 months, and then add 1 year. B. Nails rule presumes that the woman has a 28-day menstrual cycle, with conception occurring on the 14th day of the cycle. Slight vaginal spotting may occur in early gestation for unknown reasons, but is insignificant in the calculation of Nails rule. C. Nails rule presumes that the woman has a 28-day menstrual cycle, with conception occurring in the 14th day of the cycle. Slight vaginal spotting may occur in early gestation for unknown reasons, but is insignificant in the calculation of Nails rule. D. Nails rule presumes that the woman has a 28-day menstrual cycle, with conception occurring on the 14th day of the cycle. Slight vaginal spotting may occur in early gestation for unknown reasons, but is insignificant in the calculation of Nails rule. Topic 6. Questions Set F. Question 92. On the third postpartum day, a client complains of extremely tender breasts. On palpation, the nurse notes a very firm, shiny appearance to the breasts and some milk leakage. She is bottle feeding. The nurse should initially recommend to her to. Here are the options. Option A. Take 2 ibuprofen Motrin tablets by mouth now because the baby will be returning for feeding in 20 minutes. Option B. Allow the infant to breastfeed at the next feeding time to empty the breasts. Option C. Apply ice packs to the breasts and wear a supportive, well-fitting bra. Option D. Take a warm shower and express milk from both breasts until empty. The correct answer is option C. Apply ice packs to the breasts and wear a supportive, well-fitting bra. A judicious use of analgesics is appropriate with breast engorgement. However, mechanical suppression would be the initial recommendation. The breastfeeding every 11-23 hours will reduce and or prevent breast engorgement. Breastfeeding will promote milk production, which will compound the distension and stasis of the venous circulation of engorgement in a bottle-feeding mother. C. Ice packs reduce milk flow while the snug, supportive bra provides mechanical suppression and decreases pulling on Cooper's ligament. In addition, breast binders or ace bandages may be used for some women. D. Warmth promotes milk production and may stimulate the letdown reflex. These measures would contribute to the venous congestion of engorgement. Question 93. A registered nurse is trying to determine the appropriate care that she should provide for her obstetrical clients. Which of the following documents is considered the legal standard of practice? Here are the options. Option A, State Nursing Practice Act. Option B, AHN Standards for the Nursing Care of Women and Newborns. Option C, American Nurses Association Standards of Maternal Child Health Nursing. Option D, International Council of Nurses Code. The correct answer is option A, State Nursing Practice Act. The State Nursing Practice Act determines the standard of care for the professional nurse. The AHN standards are published as recommendations and guidelines for maternal-newborn nursing. C. American Nurses Association standards are published as recommendations and guidelines for maternal-child health nursing. D. The International Council of Nurses Code emphasizes the nurse's obligations to the client rather than to the physician. It is published as recommendations and guidelines by the International Organization for Professional Nursing. Question 94. A female client admitted to the labor and delivery unit thinks her bag of water broke approximately 2 hours ago. She is having mild contractions 5 minutes apart. The most immediate nursing intervention would be to. Here are the options. Option A, note the color and amount of fluid on her clothes. Option B, assess the FHR. Option C, notify the physician. Option D, place the nitrazine test paper at the cervical OS and note the color change. The correct answer is option B, assess the FHR. Amniotic fluid is generally pale and straw-colored. Meconium-stained amniotic fluid would indicate a previous hypoxic episode. This intervention, though appropriate, is not the immediate priority. B. With rupture of the membranes, the umbilical cord may prolapse if the presenting part does not fill the pelvis. Assessing FHR ascertains fetal well-being. See more information regarding fetal status and assessing for membrane rupture is needed prior to contacting the physician. Denitrazine test paper differentiates amniotic fluid from urine. Amniotic fluid is normally alkaline in contrast to urine, which is acidic. This intervention, though appropriate, is not the immediate priority. Question 95. A new mother experiences strong uterine contractions while breastfeeding her baby. She excitedly rings for the nurse. When the nurse arrives, the mother tells her, "Something is wrong. This is like my labor." Which reply by the nurse identifies the physiological response of the client? Here are the options. Option A. Your breasts are secreting a hormone that enters your bloodstream and causes your abdominal muscles to contract. Option B. Prolactin increases the blood supply to your uterus, and you are feeling the effects of this blood vessel engorgement. Option C. The same hormone that is released in response to the baby's sucking, causing milk to flow, also causes the uterus to contract. Option D. There is probably a small blood clot or placental fragment in your uterus, and your uterus is contracting to expel it. The correct answer is option C. The same hormone that is released in response to the baby's sucking, causing milk to flow, also causes the uterus to contract. A mammary growth as well as milk production and maintenance in the breast occur in response to hormones produced primarily by the hypothalamus and the pituitary gland. The prolactin stimulates the alveolar cells of the breast to produce milk. It is important in the initiation of breastfeeding. See oxytocin, which is released by the posterior pituitary, stimulates the letdown reflex by contraction of the myoepithelial cells surrounding the alveoli. In addition, it causes contractions of the uterus and uterine involution. D. After pains may occur with retained placental fragments. A bowed uterus and continued bleeding are other symptoms that occur in response to retained placental fragments. Question 96. A 20-year-old female client delivers a stillborn infant. Following the delivery, an appropriate response by the labor nurse to the question, "Why did this happen to my baby?" is, here are the options. Option A. It's God's will. It was probably for the best. There was something probably wrong with your baby. Option B. You're young. You can have other children later. Option C. I know your other children will be a great comfort to you. Option D. I can see you're upset. Would you like to see and hold your baby? The correct answer is option D. I can see you're upset. Would you like to see and hold your baby? A. The mother and the father require support. The nurse should not minimize their grief in this situation. B. Attachment to this infant occurs during the pregnancy for both the mother and father. Another child cannot replace this child. C. Attachment to this infant occurs during the pregnancy for both the mother and father. Siblings will not replace their feelings or minimize their loss of this infant. D. Holding and viewing the infant decreases denial and may facilitate the grief process. The nurse should prepare family members for how the infant appears she is bruised and provide support. Question 97. A client's prenatal screening indicated that she has no immunity to rubella. She is now 10 weeks pregnant. The best time to immunize her is, here are the options. Option A. In the immediate postpartum period. Option B. After the first trimester. Option C. At 28 weeks gestation. Option D. Within 72 hours postpartum. The correct answer is option A. In the immediate postpartum period. A rubella vaccine is made with attenuated virus and is given in the immediate postpartum period to prevent infection during pregnancy and subsequent adverse fetal and neonatal sequelae. Mothers are advised to prevent pregnancy for 3 months following immunization. B. Rubella infection during the second trimester may result in permanent hearing loss for the fetus. C. Rogam is the drug generally administered at 28 weeks gestation to Rh-negative women. It is contraindicated to administer rubella vaccine during pregnancy. D. Rogam is the drug administered within 72 hours postpartum to Rh-negative women to prevent the development of antibodies to fetal cells. Question 98. A 24-year-old woman who is gravida 1 reports, I can't take iron pills because they make me sick. She continues, my bowels aren't moving either. In counseling her based on these complaints, the nurse's most appropriate response would be, it would be beneficial for you to eat. Here are the options. Option A. Prunes. Option B. Green leafy vegetables. Option C. Red meat. Option D. Eggs. The correct answer is option A. Prunes. Prunes provide fiber to decrease constipation and are an excellent source of dietary iron, as the prenatal client is not taking her supplemental iron and iron deficiency anemia is common during pregnancy. B. Green leafy vegetables provide a source of fiber and iron, however, prunes are a better source of both. C. Red meat is a good iron source but will not address the constipation problem. D. Eggs are a good iron source but do not address the constipation problem. Question 99. A 26-year-old female client presents at 10 weeks gestation. She currently is a G31-0-1-1. Her mother and grandmother have heart disease. Her grandmother also has insulin-dependent diabetes. The client's previous delivery was a term female infant weighing 9 lb 13 Oz. The client is 5 ft 6 inches tall and her current weight is 130 lb. Based on her history, she is at risk for developing diabetes in pregnancy. Which of the following factors places her at risk for gestational diabetes? Here are the options. Option A. Age 25 years. Option B. Maternal weight. Option C. Previous birth of an infant weighing 9 lb. Option D. Family history of heart disease. The correct answer is option C. Previous birth of an infant weighing 9 lb. A maternal age older than 30 years is an identified risk factor for diabetes. Age younger than 30 years is insignificant for diabetes unless there is a familial history of diabetes. B. The client's weight is appropriate for her height. Obesity or pregnancy weight 20% of the ideal weight is a contributing factor to the development of gestational diabetes. C. The birth of an infant weighing 9 lb 4000 g is an identified risk factor for gestational diabetes. D. A familial history of heart disease is insignificant in the development of diabetes. However, a familial history of type Roman II diabetes mellitus is identified as a risk factor in the development of diabetes during pregnancy. Question 100. The nurse assesses a client's monitor strip and finds the following: uterine contractions every 3-4 minutes, lasting 6,070 seconds. FHR baseline 134,146 bpm, with accelerations to 158 bpm with fetal movement. Which nursing intervention is appropriate? Here are the options. Option A. Notify physician of non-reassuring FHR pattern. Option B. Turn the client to her left side. Option C. Start Roman 4 for fetal distress and administer O2 at 68 liters by mask. Option D. Evaluate to see if the monitor strip is reassuring. The correct answer is option D. Evaluate to see if the monitor strip is reassuring. These indices are within normal parameters. Therefore, the nurse does not need to contact the physician. The purpose of turning a client to her left side is to maximize uteroplacental blood flow. Based on the above assessment, there is no indication that blood flow is compromised. These interventions are appropriate nursing interventions for late and prolonged decelerations. Following these interventions, the nurse should notify the physician. These indices are within normal parameters. Therefore, the nurse does not need to start in Roman 4 and administer O2. D. Variations of 20 bpm above or below the baseline FHR is considered normal. Normal FHRs range from 120,160 bpm. As the fetus moves, the FHR increases and accelerations often occur in concert with contractions. During the active phase of labor, the frequency of uterine contractions is every 24 minutes with an appropriate duration of 60 sec. Question 101. Early in her 9th month of pregnancy, a client has been diagnosed as having mild preeclampsia. In counseling her about her diet, the nurse must emphasize the importance of, here are the options. Option A. Decreasing her sodium intake. Option B. Decreasing her fluids. Option C. Increasing her carbohydrate intake. Option D. Eating a moderate to high protein diet. The correct answer is option D. Eating a moderate to high protein diet. Women with pregnancy-induced hypertension have a reduced plasma volume secondary to venous vessel constriction, not hypovolemia. Therefore, sodium restriction is not recommended. It is suggested that these women avoid extremely salty foods. B. Drinking 6 to 8 glasses of water per day facilitates optimal fluid volume and renal perfusion, but it will not decrease the venous vessel constriction of pregnancy-induced hypertension. C. Carbohydrate needs increase during pregnancy, specifically during the second and third trimesters, but they have not been linked to pregnancy-induced hypertension. D. Loss of urinary protein proteinuria is associated with increased mobility of the large protein molecules with pregnancy-induced hypertension. Additional dietary protein also helps increase the blood pressure. Diets deficient in protein have been linked to pregnancy-induced hypertension. Question 102. A 30-year-old client in the third trimester of her pregnancy asks the nurse for advice about upper respiratory discomforts. She complains of nasal stuffiness and epistaxis, most noticeable on the left side. Which reply by the nurse is correct? Here are the options. Option A. It sounds as though you are coming down with a bad cold. I'll ask the doctor to prescribe a decongestant for relief of symptoms. Option B. A good vaporizer will help. Avoid the cool air kind. Also try saline nose drops and spend less time on your left side. Option C. These discomforts are all a result of increased blood supply. One of the pregnancy hormones, estrogen, causes them. Option D. This is most unusual. I'm sure your obstetrician will want you to see an ENT ear, nose, throat specialist. The correct answer is option C. These discomforts are all a result of increased blood supply. One of the pregnancy hormones, estrogen, causes them. A decongestant may exaggerate the nasal stuffiness associated with pregnancy. Judicious use of decongestants and nasal sprays is advocated during pregnancy. B. Cool air vaporizers and saline drops may help to relieve the nasal stuffiness. Positioning on either lateral side does not decrease nasal stuffiness or prevent epistaxis. C. Increased estrogen levels result in nasal mucosa edema with subsequent nasal stuffiness. Estrogen also promotes vasodilation, which contributes to epistaxis. The nurse may recommend cool air vaporizers and saline drops to help with the nasal stuffiness. D. Increased estrogen levels result in nasal mucosa edema with subsequent nasal stuffiness. Estrogen also promotes vasodilation discomforts associated with pregnancy. Question 103. A newborn girl's father expresses concern that the newborn does not have good control of her hands and arms. It is important for the father to realize certain neurological patterns that characterize the newborn. Here are the options. Option A. Mild hypotonia is expected in the upper extremities. Option B. Purposeless, uncoordinated movements of the arms are indicative of neurological dysfunction. Option C. Function progresses in a head-to-toe, proximal distal fashion. Option D. Asymmetrical movement of the extremities is not unusual and will disappear with maturation of the central nervous system. The correct answer is option C. Function progresses in a head-to-toe, proximal distal fashion. A term, neonates are predominantly in a flexed position with strong active muscle tone that increases. Newborns are slightly hypertonic. B. Neonatal movements may be jerky and uncoordinated as the neonate works against gravity in contrast to the buoyancy of the amniotic fluid. Jerky movements must be differentiated from the tremors of hypoglycemia, hypocalcemia, and neurological dysfunction. C. Growth of the newborn progresses in a cephalocaudal, proximal distal fashion. Knowledge regarding infant development may facilitate parental involvement and infant stimulation. D. Asymmetrical movements of the extremities are indicative of neurological dysfunction. Question 104. A client delivered a term infant 1 hour ago. Her uterus on assessment is boggy and is U+1 in contrast to the previous assessment of U2. The immediate nursing response is 2. Here are the options. Option A. Administer Methergin IM. Option B. Remove the retained placental fragments. Option C. Assist the client to the bathroom and provide cues to stimulate urination. Option D. Massage the fundus until firm. The correct answer is option D. Massage the fundus until firm. A Methergin is given following placental delivery to promote uterine contractions and prevent hemorrhage. Methergin may be administered in this clinical situation, but fundal massage would be a first response. The removal of retained placental fragments is done by the physician and is not the first response. See if the fundus rises and is deviated. Particularly to thyrite, the nurse should suspect bladder distension secondary to bladder and urethral trauma associated with birth and decreased bladder tone following delivery. Therefore, women have a diminished sensation to void. D. A boggy fundus rises and is indicative of blood pooling, predisposing the woman to clot formation. Massage the uterus until firm. Too vigorous massage will result in atonia. Clots may be expelled by a kneading motion of the uterus by the nurse. Question 105. A 35-year-old prima gravida comes to the clinic for her first prenatal visit. The midwife, on examining the client, suspects that she is approximately 11 weeks pregnant. The pregnancy is positively confirmed by finding. Here are the options. Option A. Chadwick's sign. Option B. FHR by ultrasound. Option C. Enlargement of the uterus. Option D. Breast tenderness and enlargement. The correct answer is option B. FHR by ultrasound. A Chadwick's sign is a presumptive sign of pregnancy. The coloration may not subside from past pregnancy or could be caused by other situations that create vasocongestion. The FHR movement observed on ultrasound is a positive diagnosis of pregnancy. C. Enlargement of the uterus may be due to fibroids or infection. It is considered a probable sign. D. Breast tenderness and enlargement is a presumptive sign because it may be due to other conditions, such as premenstrual changes. Question 106. A female client has been treated since childhood for mitral valve prolapse. The antibiotic of choice for her during pregnancy would be. Here are the options. Option A. Sulfa. Option B. Tetracycline. Option C. Hygrelazine. Option D. Erythromycin. The correct answer is option D. Erythromycin. A sulfa is a teratogen and will cause kernicterus. B. Tetracycline is a teratogen and will affect tooth development. C. Hydralazine is not an antibiotic but a calcium channel blocker. D. Erythromycin is safe during pregnancy and can be used when the client is allergic to penicillin. Question 107. A pregnant client complains of varicosities in the third trimester. Which of the following activities should she be advised to avoid? Here are the options. Option A. Sitting with legs crossed at ankles. Option B. Wearing thromboembolic disease TED stockings. Option C. Wearing support pantyhose. Option D. Wearing knee-high stockings. The correct answer is option D. Wearing knee-high stockings. A sitting with the legs crossed at the ankles does not interfere with circulation or create pressure points. The TED stockings will help to reduce the varicosity by supporting the vein. Stockings must be applied with legs elevated. C. Support pantyhose help to reduce the varicosity by supporting the vein. They also provide support to the uterus and allow for better return circulation. Hose must be applied like TED stockings. D. Knee-high stockings create constriction and pressure points that interfere with circulation in the lower extremities.